Now, do you feel like you're losing too much blood during your periods? Today on the Purity Afya show, we talk about heavy periods, when it's just not too much or when it's medically too much. Let's dive into this conversation. Joining me now is Dr. Maureen Owiti for this discussion. I am your host, Purity Museo Nzuki. Welcome, Daktari.
Thank you so much, Purity.
Yes, so what defines a heavy period medically?
Okay, so always for you to know it's heavy, you have to know what is normal. Okay, so two things will tell you it's normal. It's based on what are you using to contain your periods, and are there any presence of clots in the menstrual effluence or flow. So on average, I think because menstrual pads, to my belief, are the most popular form of menstrual hygiene products sold in the market. So on average, if we're just using normal pads, most women will use anything from 4, 5, 6 pads in a 24-hour period. When you start needing 8 pads, a whole packet, definitely that is heavy flow. Another very interesting thing about menstruation is that in the uterine cavity, we have a substance that actually prevents the blood from clotting, what we call an anticoagulant. So the amount of that substance is limited, and it's enough to contain what would be a normal cycle and a normal amount of blood coming out during the periods. The moment you start seeing their clots, what does that mean? It means you've exhausted the amount of that anticoagulant, and because it's no longer there, normal blood, when it's there, if it doesn't have an anticoagulant, it's going to clot. And that's when you start seeing the presence of clots in your menstrual flow. So someone is able to tell that they have heavy menstrual flow when they're using, like maybe when you're younger, when you start your periods, and there are some people who have heavy periods right from the onset. But just say there's what you consider normal, and what we have described, maybe 4 or 5 pads in a day, and all of a sudden you need 6 pads, 7 pads, 10 pads, a whole packet, 2 packets. That is definitely very, very, very abnormal. And if you're not having clots and all of a sudden you find there are clots in your flow, then definitely that is an indication that the flow could be heavy. And the most telltale sign is if during periods all of a sudden you find you're not having other symptoms. You're getting severe headache, you're getting dizziness, you're even fainting. And that could be a sign that the flow is so heavy, it's causing you to be anemic and now have symptoms because the flow is just too much. For some people, if you look at them, if you look at the color of the palm of their hands, like if I look at yours, I don't know, it's a bit lighter than mine.
Is it normal?
I think I'll do investigations to 𝗪𝗲𝗃𝗍 show. You can tell me, but I don't want to particularly embarrass you on the show. We came to help women with their own issues.
No, it's not embarrassing.
Yes.
You tell me.
No, we'll talk once we finish this.
Okay.
But you should have, when you look at somebody, they should have a good, nice, red, pink color on their mucosal surfaces. So you can see mine, my blood is enough. It's good. So at least I'm not worried about myself.
Yes.
Again, depending, if mine is say 13, yours could be 10. 10 is still normal. But anything less than 10, and especially if you're having symptoms, your headache, you find dizzy, you fainted, it could mean that there's something serious that needs to be looked out for. The only challenge is we also tend to have a lot of iron deficiency in this part of the world. So you have a lot of women, they have iron deficiency, they already have anemia, that is low blood levels. And so even just a normal cycle will make them feel dizzy. So those are some of the elephants in the room. But are they having the heavy bleeding? Are they changing those 10 pads? Are they having clots? Then that would be heavy bleeding.
So what causes this excessive or heavy bleeding during menstruation?
Okay. So the causes are so numerous. So numerous. And we say common things occur more commonly. We're Kenyans. Kenyans are Africans. So you find women of African origin or descent have a higher propensity for getting fibroids. Okay, so fibroids could be a cause for heavy bleeding, and it's understanding not all fibroids cause heavy bleeding. It'll be mostly fibroids that are inside the cavity of the uterus. Those, even a very, very tiny fibroid can make you have very heavy bleeding. Or fibroids that are not necessarily in the cavity, but are in the muscle, but are causing the lining to change shape. Okay, that would also cause you to have a bit of bleeding. If you have a fibroid on the outer surface of the uterus, when it's a big fibroid, it's not necessarily going to cause you to have heavy bleeding. And I hope that we're sticking just to heavy menstrual bleeding, because causes of bleeding are very many. Then, so as I said, for me, that would be the most common reason that we see heavy bleeding in this part of the world. You have other issues. We have things like polyps. But the interesting thing about polyps is that you can even have bleeding outside of the period. But you find that even during the period itself, it can make that the bleeding is heavy. So talk about fibroids, talk about polyps, any tumor. So if you find somebody has something like endometrial cancer, okay, or hyperplasia, so that's a state before you get the actual cancer. So the lining is thickened. It can be associated with heavy bleeding, but again, it's more associated, like, for example, women who have stopped menstruating and now they start bleeding all of a sudden. That would also be another issue around menstruation. So that would be a warning sign and a big red flag that, look, I need to get checked. Hormones. So I think we talked about there's things like thyroid, prolactin, and even these girls with polycystic ovarian syndrome. So in as much as for those patients, they don't get periods often, they get periods once in 6 months. But it means for 6 months, your lining has been building. So it was like umeweka gate, like a dam. It's like you close the dam, and then when the dam opens, it's just a floodgate. They can bleed a lot. Not all of them, but some patients do experience that because of the prolonged duration of not having the bleeding. So if we look at that, there's also the issue of medication. So we have people who have, say, heart conditions or have bleeding disorders whereby they form clots in their bodies, what we call deep vein thrombosis, or venous thromboembolic disease. Such patients have to be on blood thinners. Now, when you're a blood thinner, you find that during the period, you can bleed much heavier than when you're not on a blood thinner. And again, now that we've mentioned blood thinners, any blood condition, what we call hematological condition, that increases bleeding. So you have those people who have what we call hemophilia, whereby they bleed more than normal. Such people could also have very heavy menstruation.
So now, heavy menstruation or heavy period is a problem. Are there treatment options?
Oh, definitely. I think gynaes are very interesting people because we use the same drug to treat the opposite things, okay?
Yeah.
So in terms of treatment options, for heavy bleeding, we have quite a number of things.
Yeah.
The most common thing that we're going to use is a progestin, okay? And we use progestin so you don't get periods to start them again. But how we're going to use it will be a bit different.
Yeah.
And then we use progestin to stop heavy bleeding.
Yeah.
We also have, I think most people who have ever gone to see a doctor and the issue has been that they're having heavy bleeding, majority will tell you that they'll put on a contraceptive pill.
Yeah, yeah.
So a contraceptive pill has progesterone or the progestin, and also has estrogen. So we have compounds which have progesterone alone. We also have compounds that have estrogen alone.
Yeah.
But the pill has a combination of both estrogen and progesterone, and that would help make the bleeding less and also more cyclical. If you don't use that, we have other more complex compounds, other hormonal issues. I really don't want to delve into that. I think for the user, if it would not be very useful. But we have a lot of that. But in terms of, if I look at progestins, they come in very many interesting forms. So obviously things like the pill, you can get an implant, you can get injection, and even we have a special coil. It's called 𝗪𝗵𝗲𝗃𝘆 intrauterine device. And we can put that in the uterus and help women who have heavy bleeding to control the bleeding that they're having.
Right.
If medical treatment doesn't work, I think we have, outside of hormones, we have some group of painkillers, what we call non-steroidal anti-inflammatory drugs. We call them NSAIDs for short. The common ones that maybe people would know be things like Brufen, diclofenac, Ponstan. That group of drugs also helps a lot. You can use that for two things: to reduce the amount of bleeding and also reduce the amount of pain during periods.
All right.
Yeah.
So okay,
there's still a lot, as in my arsenal, my bag of magic tricks.
I know.
Yeah,
but
we have
Doc,
quite a bit,
Doc, as we wrap it up, what should a woman be concerned about? Maybe you can leave us with a few tips on what we should be looking at during our monthly period.
Okay.
Yeah.
So in terms of if it's just heavy, please, you should not be using more than 6 pads in a 24-hour period, and you should not be having clots when you're having bleeding. And definitely by the time your period comes around and you find that you're having headaches, you're having dizziness, you're fainting, you definitely need to see a doctor. Something is not right and you need to get checked.
All right. I think it's a good note to wrap the show up. And if this episode has helped you or someone in any way, remember to like, share, and comment. And don't forget to subscribe if you are yet to do that. I was your host, 𝗪𝗏𝗄𝗄. I'll see you again next week, same place, same time. Bye-bye for now.